The fourth ventricle is the cavity of the hindbrain. It is a tent-shaped space situated between the pons and the upper part of the medulla oblongata, in front and cerebellum behind. Here you can see the fourth ventricle, which, which lies between the pons and medulla anteriorly and cerebellum posteriorly. Boundaries. It is bounded laterally on each side by gracile tubercle, cuneate tubercle, inferior cerebral peduncles, superolaterally by superior cerebral peduncle. The floor is also known as rhomboid fossa. It is rhomboidal in shape. It is formed by posterior surface of the lower part of the pons and posterior surface of the open or the upper part of the medulla oblongata. The structures which lie in the floor are lined by number 1 ependyma, number 2 a thin layer of neuroglia beneath the ependyma, and a layer of grey matter forming nuclei deep to the neuroglia. Parts of the floor. The floor is divisible into an upper triangular part formed by dorsal surface of pons and number 2 a lower triangular part formed by dorsal surface of medulla oblongata and a third the intermediate part which is formed by the junction of pons and medulla. It is prolonged on dorsal surface of the inferior cerebral peduncle as the floor of the lateral recess. This part is marked by transversely running fibers of striamedullaris which arise from the arcuate nucleus to the opposite cerebellum. In this diagram, you can see the three parts. The upper triangular part formed by the posterior surface of the pons is the intermediate part marked by the transversely running lines, that is stria medullaris, and the lower triangular part formed by the posterior surface of the medulla oblongata. Features. The dorsal median sulcus divides the floor into two symmetrical halves. Sulcus limitans divides each half into median eminence and lateral vestibular area. The sulcus limitans presents depression at the cranial end called superior fovea and a depression at the caudal end called inferior fovea. The median eminence is wider above and narrow below. It presents facial colliculus just opposite the medial to superior fovea. Deep to the colliculus is the genu of the facial nerve formed by this nerve looping around the abducent nucleus. Here, in this diagram of the posterior surface of diagram of the floor of the fourth ventricle, you can see here there is a median sulcus which divides the area into two halves. Lateral to this there is a sulcus limitans here which divides each half into a medial eminence and a vestibular area. This is the vestibular area. This is the intermediate part here. You can see the stria medullaris. Here you can see the there is a superior phobia on the sulcus limitans, and this is the locus ceruleus. And in the lower part, triangular part, you can see two triangles, that is the hypoglossal triangle and vagal triangle. The upper part here shows the facial colliculus. This facial colliculus is formed by winding of the facial nerve around the sixth nerve nuclei. So, and this that's where the genu of this facial nerve raises an eminence in the floor of the fourth ventricle known as facial colliculus. In the pontine part, the sulcus limitans overlies an area that is bluish in color and is called locus ceruleus. This color is blue due to the presence of pigmented neurons which form substantia ferruginosa. These neurons belong to the reticular formation. They are rich in noradrenaline and help in paradoxical sleep. Here you can see the locus ceruleus present in the sulcus limitans. Descending from the inferior fovea, there is a sulcus that runs obliquely downwards towards the midline. This sulcus divides the medial eminence into two triangles. These are the hypoglossal triangle medially and vagal triangle laterally. These triangles overlie the hypoglossal and vagal nuclei respectively. Here you can see a oblique running sulcus. This divides the medial eminence into two parts. A upper, this is the hypoglossal triangle, and lower triangular area that is known as vagal triangle. These triangles they lie respectively over the hypoglossal nucleus and vagal nucleus. So this sulcus runs downwards and medially from the inferior fovea. Between the vagal triangle above and the gracile tubercle below, there is a small area called area proxima, which may function as chemoreceptor. An ependymal thickening called funicular sapens separates area proxima from the vagal triangle. The area proxima is devoid of blood-brain barrier. The vestibular area lies lateral to the inferior fovea, that is known as sulcus limitans, which overlies the vestibular nuclei. This vestibular area lies partly in pons and partly in medulla. The lowest part of the floor resembles the pointed nib of the writing pen, so it is described as calamus is scriptorius. The roof of the ventricle is diamond shaped and can be divided into a superior and an inferior part. The superior part of the roof is formed by superior cerebral peduncle and superior medullary velum. The superior cerebral peduncles, on emerging from the white matter of the cerebellum, pass first cranially and ventrally, forming at first lateral boundaries of the ventricle. Here you can see in this diagram you can see the roof which is tent shaped. It has got A superior part here, superior are the dorsal part, and a inferior are the caudal. This is the superior cerebral peduncles. This is the superior medullary velum. In the caudal part, you can see the inferior medullary velum, the choroid plexus here, and there are three apertures you can see over here. The This is the median aperture that is known as foramen of Magendie, and here is the lateral aperture. This lateral aperture is known as foramen of Lasca. On approaching the inferior caliculi, they converge and then intermingle over the ventricles and form part of the roof. The superior medullary velum, which is made up of nervous tissue, fills the angular interval between the two superior cerebral peduncles. It is covered on the dorsal surface by lingula of superior vermis. Here you can see the superior cerebral peduncles, and this is the superior medullary velum. The superior cerebral peduncles, they run upwards and medially towards the inferior caliculi, and the superior medullary velum here you can see it extends here between the two cerebral peduncles like a tent. Here you can see the inferior part. Here is the inferior cerebral peduncles, and here is the inferior medullary velum. This is the tila choroidea, T-shaped. You can see this is the foramen of Magendie, and this is the foramen of Plaska. The caudal inferior part of the roof, in most of its extent, consists of an exceedingly thin layer entirely devoid of nervous tissue and formed by the ventricular ependyma, and double fold of dura mater are the tila choroidea of the fourth ventricle, which covers it posteriorly. Caudally, the continuity of the sheath is broken by a gap as median aperture through which the cavity of the ventricle communicates freely with the subarachnoid space in the region of the superior medullary system. The inferior medullary velum forms a small part of the roof in the region lateral to the nodule of the cerebellum. Superior to the region of the inferior medullary velum, on each side, the layer of the tila choroidea is in contact with the ependyma of the caudal part of the roof, reaches the inferior-lateral boundary of the ventricular floor, which is marked by a narrow white ridge termed tinea. The two tinea are continuous below with a small covered margin, the obex, often used to denote the inferior angle itself. Tila choroidea. Tila choroidea is a layer of pia mater which occupies the interval between the cerebellum and the lower part of the ventricle. Its posterior layer provides a covering of pia mater to the inferior vermis, and often covering the nodule is reflected ventrally and caudally in the immediate contact with the ependyma. The tila choroidea, with vascular fringes covered by the secretory ependyma, forms choroid plexus of the fourth ventricle. These choroid plexus project in the lower part of the roof of the fourth ventricle. Each plexus consists of a vertical limb having lying next to the midline and a horizontal limb extending into the lateral recess. The vertical limbs of the two plexuses lie side by side so that whole structure is T-shaped. The vertical limb of T-shaped structure reach the median aperture and project into the subarachnoid space through it. The lateral ends of the horizontal limbs reach the lateral apertures. The arterial supply of these plexuses is from the posterior inferior cerebral arteries. Here you can see this T-shaped structure of the tila coradia. The two vertical limbs they run side by side and reach to the foramen of mesentery, while the horizontal limbs laterally extends through the foramen of lusca in the lateral recess. Communications. The cavity of the fourth ventricle communicates inferiorly with the central canal and superiorly with the cerebral aqueduct. Openings in the roof. In the caudal part of the roof, there are three openings, one median and two lateral. The median aperture of the fourth ventricle is also known as foramen of mesentery. It is a large opening situated caudal to the nodule. The median aperture provides principal communication between the ventricular system and the subarachnoid space. Here you can very well see the foramen of mesentery through which the fourth ventricle communicates with the subarachnoid space. Here it is the foramen of Lusk. The lateral apertures are also known as foramen of Lusk. They are situated they are situated at the lateral ends of the lateral recesses and are partly occupied by choroid plexus which protrude into the subarachnoid space. Through the foramen of Lasca, also fourth ventricle communicates with the subarachnoid space. Angles. The, fo- the fourth ventricle has a superior angle, an inferior angle, and a lateral angle. The superior angle continues with the cerebral aqueduct. The inferior angle is continuous with the central canal of the spinal cord. The lateral angles, one on each side, towards the inferior cerebral peduncles. Cavity and recesses of the fourth ventricle. The cavity lies between the roof and floor of the ventricle. The recesses are the extension of the main cavity of the ventricle. The five recesses has been identified. There are two lateral recesses, one on each side. Each lateral recess passes laterally in the interval between the inferior cerebral peduncle, ventrally, and the peduncle of the flocculus dorsally, reaching as far as the medial part of the flocculus. Here you can see the cavity. It has got two lateral recesses, one dorsomedian recess and two dorsolateral recesses. So that way there are five recesses, two lateral, two dorsomedial, dorsolateral and one dorsomedian. The one median dorsal recess, it is present in median plane. It extends dorsally into the white core of the cerebellum and lies above the cerebellar nodule. The two lateral dorsal recesses, one on each side, each lateral dorsal recess extends dorsally, lateral to the nodule and cranial to the inferior medullary vela. These lie on either side of the median dorsal recess. Clinical anatomy. The vital centers are present in the vicinity of the vagal triangle. An injury to this area is therefore proved fatal. Number two, the infratentorial brain tumors may block the foramen of Magendie and foramen of Lusca, situated in the roof of the fourth ventricle. This results in early rise of intracranial pressure, which causes headache, vomiting, papilledema, etc. So this is all about the fourth ventricle, its boundaries, its features, and the clinical anatomy